You know, my experience with the MALO implants has been nothing but fantastic.
I've had it in a year and a half now, and it's no problems, none whatsoever. Best thing I ever did.
I can honestly say MALO Clinic gave me my life back.
It absolutely changed my life.
I didn't feel like wearing the dentures, but I was very self-conscious and depressed some of the time.
I'm a controller of a small company, and I interact with vendors and salespeople every day, and sometimes the denture will get loose, and I'll have to excuse myself and go fix it and then come back.
When my kids' friends were around, and we'd be goofing around, and I'd be smiling a lot and laughing, they'd always tell me not to smile because not that it bothered them, they didn't want their friends to see me without any teeth.
My friend had the implant procedure about 10 years ago, and it just took almost a year for her to get everything done.
I had a lower denture that I didn't have, it wouldn't stay in my mouth. I used all different types of adhesives. Every time I went to eat, and it was very uncomfortable because, you know, when you go out with friends and clients, you go to a restaurant and you sit down at the table and you go to eat something and things, you know, starts moving in your mouth. It was a very uncomfortable situation.
More than 240 million people in the U.S., Europe, and Japan are missing some adult teeth. And more than 35 million in the United States alone are edentulous, or missing all their teeth. These people are not just poor or from third world countries. They're not all over 80 years old with aging teeth. This multitude of edentulous people are our everyday friends, neighbors, and business associates who are suffering from the dreaded problems of missing teeth. Dr. Malo's solution provides these patients with a less invasive procedure using only 4 implants to support an entire upper or lower set of replacement teeth. But best of all, for qualified candidates, this procedure and new teeth can be accomplished in just 1 appointment and in less than 1 hour.
All the doctors in the United States and in Europe, when I was visited, told me that I'm not candidate for implants. And Dr. Molina was the first doctor who said, yes, I can do it and it will work for you.
I dreaded going to events or speaking with people now. You know, I speak with ease, I speak with confidence.
Our patient Pam is a 50-year-old businesswoman who comes all the way from Denver, Colorado to Augusta because for more than 30 years, she has endured the unpleasantness of wearing a full denture on the entire upper ridge of her mouth. So what will Pam's procedure be like? Prior to her surgery, and like this patient, Pam received a 30-second 3D CAT scan. Through the use of 3D scanning, the surgeon is able to plan a virtual surgery that helps identify where to place the implants to avoid the nerves and sinuses. The results from the scan help determine the size of the needed implants, depth of placement, and the density of the bone.
By using the CT scan, we can plan the ALL-ON-4 treatment using the Noble Guide system. This allows us to do the surgery and to place the new teeth in only 1 appointment.
It was not painful. It was done in a couple of hours, and I was able to eat dinner that night, which I didn't think I was able when Dr. Molina told me, you're going to have dinner tonight. I said, yeah, sure. But I was able to.
Previously, patients needed an implant for virtually every missing tooth. This resulted in large amounts of bone grafts and ongoing implant procedures that could take up to a year. But the types of implants Dr. Malo designed for Noble Biocare are a major breakthrough. Now, as you will see, it takes only 4 implants to support an entire upper or lower set of teeth.
One of the characteristics of ALL-ON-4 is the use of angulated implants. By using angulated implants, we only need 4 implants, which brings down the cost and eliminates the need of bone grafting.
Based on the information from the CAT scan, a Noble Guide like this was made showing the surgeon where to precisely place the implants. This Noble Guide was made in advance in a virtual surgery done on a computer. Once the Noble Guide is placed into the patient's mouth, Dr. MALO will place 4 implants where the holes have been marked.
With this guide, generated by computer, we know exactly where to place the implants.
Dr. Molina made up the special denture, and they attached it to the implants, and it's a permanent. They screw it in, and it just becomes part of your mouth. And once the anesthetic wears off, no pain. There was nothing. It was just great.
Through additional computer CAD/CAM scans of the patient's denture, the lab will match the patient's replacement teeth to the guide. The surgery, the implants, and the teeth are all part of the Noble Biocare Immediate Function All-on-4 Guided Surgical System. With advanced planning of the surgery and advanced production of the patient's new teeth, the procedure can move along much faster.
Here we are at our lab. No matter how well you plan the case, no matter how well you do the surgery, if at the end of the day you do not have perfect teeth that look like and function like natural teeth, then the case is not well done.
The replacement teeth are made in advance in the on-site lab, so they're ready to be placed at the time of surgery. They're made of acrylic or ceramic and are eventually supported by a titanium bar, so they're very strong and can last a lifetime.
It's your teeth. It's there. It's implanted in your jaw. You can't take it out. It's not like a denture. You can just pop it out. It's there. It's yours.
Are you ready to do the surgery?
I'm petrified.
I'm just going to explain to you what I want to do. Okay? So basically, I want 2 things. I want you to have a nice bite. Okay? I want you to bite well. When was the last time you've bitten an apple?
About 30 years.
All right. What if I tell you that straight after the surgery you'll bite an apple? You believe me?
No.
All right. Okay. You don't want to bet on that, right?
No.
Because you lose. All right. The second thing I want to do is I would like to have your lips a little bit thicker and the red of your lip a little bit more, showing a little bit more. Okay? So these are the 2 things we're going to do after the surgery, and you'll be able to see that right after the surgery.
So how will the All-on-4 procedure work?
We have come to a very special time, which is no more bone grafting. We always go for immediate function. We place teeth within 1 hour, which will be the case of today, I hope, or 3 hours if we go for the open flap.
Like this video shows, everything has been pre-planned and pre-made so that the surgery and the placement of newly fabricated teeth will be completed within a half hour. First, the Noble Guide will be placed into the patient's mouth to show where to place the implants. Then 4 implants will be precisely placed to support the entire upper ridge of teeth. Once the implants are in, they're tightened down and the guide is removed.
Look at this. I don't know how much time it's been gone, but I'm sure that must have been about 15 minutes. Surgery is finished.
After the guide has been removed, the new teeth are attached.
Go on.
Pam's procedure goes smoothly, and she's able to eat an apple immediately following her procedure.
It's just a great thing. Your confidence level just goes right up. You don't have to worry about your denture falling out or yelling and something happens. It's there, it's in, and it's not going anywhere.
The procedure changed my life greatly because I have grandchildren. I can play with them. I don't have to worry that my denture will come out. I can enjoy smiling. I can enjoy talking to the people. And it's good to have teeth in the mouth.
Since the surgery, I wasn't afraid to eat anything. I wasn't afraid that the dentures was going to slip, or I had to put my hand over my mouth in case they were slipping or excuse myself or anything like that.
Right.
All right, you guys, this is it. I haven't had steak in a long time that I've been able to chew. This is awesome. At work, I used to have to excuse myself because I could feel my denture slipping or something, but now I feel more confident and I seem to be smiling a lot more. It was great. Corn on the cob, yeah! When I went into the implant center for the very first time, and they told me how much it cost, I was just amazed on how expensive it was. But I got to figure on how much it cost me for new dentures every 10 to 10 years, how much it cost me for denture cream, how much it cost to clean it. You know what, it's well worth it. And I'm going to do it again here in about a year. I'm going to have the bottoms completely done.
Like, you know, they tell you, you know, you have baby teeth and you lose those, and then you get your permanent teeth, and once you lose those, that's it. This is like, you know, you're a third shot. You know, you got that third shot. You got another set of teeth, and they're yours. They're in your mouth, and you can't take them out.
Hello everybody, this is a Noble Guide ALL-ON-4 upper and lower at the same time, and this allows us to do these cases without need for bone grafting, so which is very convenient. So this is what we call the easy ALL-ON-4, and now we'll place all this in the mouth. This is the tricky part. We have to work with both guides at the same time. We cannot do one and then the other. Now we are going to do a 2.8 drill, and we will try now to place an implant. There we go. We placed at 50 newtons right where we should. And now we are going to do the upper case now. Notice that with the ALL-ON-4 we don't really need a lot of bone, but besides that, the advantage of the ALL-ON-4 is that the patient does not have to open the mouth as much as if you do not use an ALL-ON-4.
You know, bottom line, the end results were, I think, well worth the wait.
Okay, good. So basically, we have finished the surgery, and now we want to take the implant mounts away. Like when people argue that you can place more implants, of course you can. What if you can't place more than 4? Shall you go to the bone transplant? And if you place more than 4, what do you gain? Are we concerned about success rate? If you charge per implant, then you are an implant seller, not a doctor. And I think that is wrong.